Michelle Strider, and I'm here to talk to you today about careers in healthcare quality and how those careers can help to further the kingdom of God by promoting the value of every human life. So despite advances in modern day medicine, medical errors continue to rise. These medical errors lead to deaths in hospitals and outside of hospitals, and it is these medical errors that healthcare professionals and healthcare quality seek to address. I am a registered nurse. I worked for many years in a cardiac floor, and I currently work in quality as a clinical quality analyst and now the director of quality. One reason I am so passionate about seeing changes in advancement of patient safety is because I have seen my own personal patients experience medical errors throughout the hospital system. So when our patients come into the hospital, they have three basic expectations. Heal me, don't hurt me, and be nice to me. Heal me talks about the quality of care that we provide to a patient. Don't hurt me is talking about the safety of the care that we provide to a patient. And be nice to me is talking about patient satisfaction. According to a study published by the Journal of Patient Safety by John James in September of 2013, deaths due to medical errors are now the third leading cause of deaths in the United States, with over 400,000 medical-related deaths occurring a year. A study titled The Actual Causes of Death in the United States in 2000 published that number is probably actually low because it only focuses on the inpatient crowd. Whereas this study, entitled The Actual Causes of Death in the United States, claims that for every 1 out of every 10 surgeries, there's a medical death related to medical error, and that 1/3 of those deaths occur once the patient is already outpatient. So those numbers are not reflected in the 400,000 per year deaths earlier cited. So what is our responsibility when it comes to these errors? Well, as patients in healthcare quality, it is our responsibility to find ways to hardwire these errors not to occur. James Conway, when he was a senior vice president of the Institute for Healthcare Improvement, said that our systems are too complex to expect merely extraordinary people to perform perfectly 100% of the time. We have an obligation as healthcare professionals to put into place systems to promote safe practice. And it's those systems that I'm going to talk to you a little bit about today. So when you think about errors, you think of also ways that we put fixes in place to address those errors. One example of this is in the automobile industry. So years ago, it was very easy when people would drive away with the gas nozzle still in their gas tank, there was many fires because the gas pump would get pulled out of the gas tank when they forgot to pull the pump out of their car. They hardwired a fix in this, in that gas nozzle detaches from the pump, and it saved many thousands of dollars. Another example is in hardwiring in our automobiles is the feature of automatic shutoff of your lights. So it used to be a lot easier to leave your lights on when you left the car, but now there are automatic lights that turn off when your car's been off for a certain period of time, which help to alleviate the issue of draining your battery due to leaving your lights on. Now, it's still possible to bypass those systems. You can still change your lights to automatic, but there is a system in place to help mitigate your errors. And that's what we look for in healthcare. As long as we have humans working in healthcare, we will always have errors, because where there are humans, there are errors. But we look for ways to mitigate those errors. And as healthcare professionals, we put in place safety nets to help catch those errors. So why is it important that we promote, that we catch those errors and protect patients? One of the reasons is that we strive to further the kingdom of God by showing that every human life has value. Genesis 1:27 says that we were created in the image of God. Jeremiah 1:5 says that He knew us before we were in our mother's womb, that He made us So that shows that God's given every human life value. And that is why we strive to value that human life by keeping it safe and providing the best quality care that we can provide. The ultimate goal of healthcare professionals is to ensure that we're meeting the expectations of our patients, that we are keeping them safe, providing them good care, and that we are meeting their expectations. The problem with errors and medical deaths in hospitals is not going to go away. It takes each of us partnering together to make hospitals a safer place for patients. And part of that partnering together is working with your local quality team and finding ways that we can hardwire that care so that we can make sure that we're mitigating those errors where we can. Thank you.